Ghana has a population of approximately 28 million based on the latest United Nations estimates. Over 842,600 are suffering from severe mental disorder, and a further 2,808 are suffering from a moderate to mild mental disorder. The treatment gap of the population with mental disorder is 98%. Recent data puts Ghana's doctor-patient ratio in the mental health sector at 1:1.7 million. Worrying as this may be, little attention is given to mental health care in the country. Ghana has 3 mental health facilities: the Accra Psychiatric Hospital, Ankafo Psychiatric Hospital, and the Pantan Psychiatric Hospital, all located in the southern sector of the country. Ghana successfully passed the Mental Health Act in March 2012 to address the challenges of mental health as a public health issue and also in the protection of the human rights of people with mental disorders. But what is the situation now? The Mental Health Authority, the body for ensuring adequate and appropriate mental health service delivery and regulation in the country, are faced with numerous challenges.
The LI is that which contains the funding mechanism, the mental health fund, either a new levy or part of existing levy. If you have that one, then all these issues will be resolved. Unfortunately, the LI is not being passed. Once the Minister of Finance appends the signature, then the parliamentarians can then put it in the LI and then they can pass it. Until then, we still have this challenge.
The mental health system in Ghana has just not been given the assistance that it needs. There's been lots of lapses and there have been gaps, and these gaps have to be filled. And the Mental Health Authority has come in to help, fill these gaps. We've not had the resources to, move it to the level that we want to move it. If we had the resources available, I think the kind of impact, it would have been so visible to everyone.
We are integrating mental health care into the general health care system using the existing structures. It's not a parallel structure that we are creating, the existing structures that we are using. Mental health care was institutionalized, medicalized, and centralized. Okay. So if you have mental disorder, formally it's mainly medicine. But now we have incorporated other forms of care. Formerly it was either little or none, but now we have incorporated other forms of management. Mental health care, as stated in the Act, is free. It's free at the point of receiving care, okay. But somebody somewhere is supposed to fund it.
Exactly.
That is how it is.
Yes.
So that funding is inadequate. That is the challenge, the main challenge we are facing.
Over the years, these facilities have been saddled with numerous challenges in churning out quality healthcare to patients.
It's disturbing because the environment is not good enough for even people to sleep there. Okay, and that's our challenge. Anytime you enter the place, some people see the place and they weep because it's like a prison, if I should say, like a prison yard.
Our lab, machine spoil. Those who will come and repair, they also said we are owing, so they will not come. Water problem, medication or drugs is not coming as it was supposed to be. Financial position in this hospital is very bad. So we came to a time that even the hospital decided to charge patients so that we will get something to feed those who are in.
The situation is even worse in the northern part of Ghana, where there is lack of adequate facilities, including drugs and psychiatric nurses, to provide care for patients. Mental health continues to suffer neglect in this part of the country. Some NGOs are supporting, but with much difficulty.
Mental health services to be consolidated sustained and maintained in our system at all times and the rest. And that would mean support, concern, interest, and practical attention from all stakeholders. It means that it is not a project or a program that ought to be left in the hands of one initiator.
In 2015, over 100,000 patients were seen at the outpatient departments of the 3 major mental health care facilities. The top 10 mental problems patients present with on admission at psychiatric hospitals include schizophrenia, substance abuse, depression, acute organic brain syndrome, maniac depression, psychosis, alcohol deficiency syndrome, epilepsy and dementia, among others. But the question is, are these mental facilities able to give the required care to such patients? Infrastructure is in a deplorable state. Due to the structural defects, inmates at some of the facilities abscond. This roof at the Accra Psychiatric Hospital can easily be ripped off as the concrete is peeling off, exposing iron rods. Overcrowding is one major challenge confronting psychiatric institutions. Human resource is another challenge. Caregivers and nurses are at risk owing to poor security.
Night nurses are not as much as the day nurses. So if there's aggression in the night, we don't know what to do. That's why sometimes we escape the morning dose and give it in the evening.
The facility of Accra Psychiatric Hospital almost came to the brink of collapsing when at the end of 2016, nurses embarked on strike. Delays in receiving budgetary allocations put much constraint on hospitals and management at the various psychiatric hospitals as they are forced to stop admissions and even release patients to their families. Quality and quantity of food for inmates is also a cause for worry. Psychiatric hospitals in Ghana depend mostly on donations from benevolent organizations and individuals to operate. The facility are in huge debt. The 3 psychiatric hospitals often run out of medicine, consumables. One issue is lack of security. Nurses are always at the mercy of aggressive inmates. Mental health care in Ghana is still faced with the challenge of stigmatization, neglect, attribution of mental illness to spirituality, and the general lack of concern for mentally ill persons is still very common. Until much efforts are put in to salvage the current situation, Ghana cannot win the war against stigma and neglect of such patients, and these institutions will continue to struggle.